Hello and welcome. I'm so glad you were able to join me again today. So, today I'm going to talk more about understanding perimenopause and menopause. Obviously, this is a question that also gets raised because that's what we do here at Antigravity Wellness is address these issues. One of the most common things that I get asked too is how do we know that we're in, if a woman is in perimenopause or menopause, what are the signs and symptoms? Are there labs that we can do? Uh, Questions from other people who are not necessarily in perimenopause, but know someone who is. Are they ever going to be the same again? This person doesn't seem to be the same. There's many answers to these questions. So, what is perimenopause and menopause? Perimenopause is the transitional phase leading up to menopause. This can start in the 40s, but sometimes earlier and lasts an average of 48 years. And it's characterized by regular menstrual cycles, hormonal fluctuations, and causes symptoms such as hot flashes, sleep disturbances, and mood swings. So if there's anyone who is present, raise your hand if you have experienced any of these symptoms, right? So, by the way, hi, I'm Nicole. I have a doctorate of nursing practice. I'm the founder of Antigravity Wellness. And the purpose of these sessions is to give you an opportunity to come on and ask questions if you're here in the live in Facebook or on YouTube, or to catch the replay on either of those platforms. And I'm also going to be turning these into podcasts. That way, I can just get this information out there to as many people as possible. There is such a lack of information about what perimenopause is, when it starts, how we treat it. And not that we're necessarily trying to medicalize the female body any more than it already has been, but opening up to the fact that women are not just crazy. I'm sure that many women have had that experience of going into the doctor and sharing their symptoms and basically being disregarded, being told that, oh, well, we don't really know what's wrong with you, or, it's just stress. You just need to get more sleep. Or, of course, you're tired. You have a family and you're doing all these things. And getting diagnosed with depression and just putting on an antidepressant when that's not what's actually going on. And they're not even doing full functional labs to find out, okay, well, your TSH is okay, but what about your free T4? What about your free T3? What about your thyroid antibodies? I've seen clients with thyroid antibodies that were elevated before any other marker was showing. So that's called subclinical, but they can still be symptomatic and it's still wreaking havoc on the body and causing all of these other downstream effects. And if we don't address these things, you're doing a disservice. So I'm here to try and turn that tide, help to inform people about what is going on with perimenopause and menopausal women, and give, to the best of my ability, the latest research that is evidence-based and to support women to make their own choices about how they want to proceed with treatment of their bodies, to give them the most information possible. But we can't get to that point unless we share this information and we get the functional labs done that we need in order to find those answers. Okay, so what is menopause then? So menopause is defined as 12 consecutive months without a menstrual period. It typically occurs between the ages of 45 to 55. So the average age is about 52 for most women. If you have menopause before 40, it's considered early. And if it's after 55 and late 50s, it's considered late. It's just a terminology, doesn't necessarily mean much. This marks the end of the menstrual cycle and reproductive years. There is a decrease in estrogen and progesterone that is the hallmark of this situation. Common symptoms include hot flashes, night sweats, vaginal dryness, and changes in libido, among many, many others, which we're going to talk about some more. Now, I also wanted to address, and I'll take a look at the chat too while I'm over here. I also wanted to address the fact that we can also have surgical menopause. So if the uterus and or ovaries are removed, especially if there's a total hysterectomy where the uterus and the ovaries are removed, that will induce surgical menopause. What that means, that woman should be immediately treated with hormone replacement. It's like if we take the thyroid out, we immediately put them on thyroid replacement. Why it's recognized that we should be doing that, and it's not necessarily always recognized when we remove the ovaries that there's a problem, especially early. Um, hmm. I think it's getting caught up on, but I have had clients who've come to me and they've had a past history of total hysterectomy with the ovaries removed, oophorectomy, and they were never placed on hormone replacement. And they were wondering why they just feel awful. Well, they're menopausal and it was never addressed. So their body gets thrown into this situation and then nobody addressed it. So it's very important that even those women, and I do treat those types of women too, who have had surgical menopause. Also, something that people don't realize is that if the uterus has been removed, even if the ovaries were spared, the trauma from that type of a surgery, the swelling that happens, and all of the things from the recovery, it can throw them into perimenopause or even early menopause from the trauma of that. That also needs to be addressed. They need to be monitored, their labs need to be checked, their symptoms need to be checked, and they might need to be placed on hormone replacement in order to help them with that. And it goes beyond just symptom management. That's important for sure, but it's also a health and longevity issue. We know that postmenopause, the rate of heart disease, of osteoporosis, of Alzheimer's disease, and of things like colon cancer dramatically increase. And this is because we lose our estrogen. So when we lose our sex hormones, these affect the entire body and it affects our health. So it's more than just a symptomatic, we're just going to get you through these years until your body evens out. We're actually finding that we should be on hormone replacement a lot longer, like for the rest of our lives, as long as the woman is doing well and is monitored properly by a provider who knows what they're doing. All right, so postmenopause. These are the years following menopause. Symptoms may continue, but typically lessen over time. That's just kind of like everything just sort of evens out. So if you've had hot flashes and mood swings and all the issues, those typically tend to improve. But other issues like the vaginal issues, dryness, and pain with sex and things like that, those actually typically do not get better unless we are doing something about it, or if the woman has decided that the symptoms are not so bad that they really want to do anything about it. And that's fine too. It's her body. There's an increased risk of osteoporosis, cardiovascular disease due to these lower levels of estrogen. So common symptoms and challenges, because women will come and it's really funny. I talk to women in their 30s and a lot of them so often there's like two scenarios. One is after my last kid, I couldn't lose the body weight. My cycles got crazy. I've had all of the, like XYZ, all of these issues pop up. Yeah, you're perimenopausal. Or I used to be able to do all these things and keep my weight under control. And now all of a sudden, everything that I was doing before isn't working. I'm gaining weight around my belly. I'm tired. My cycles are weird. I'm having these symptoms. You're probably perimenopausal. But we don't get diagnosed with that. You go in and talked about that, and they're just like, oh, they don't put the whole picture together. And more I'm seeing that this is the case. Now, we also need to look at things like your thyroid functioning, your gut health, your adrenals, your stress level, your chronic fatigue. All of these things will contribute to having earlier signs and symptoms of perimenopause. And there's things that we can do to reverse this process so you're not having those symptoms as much or even at all. And then your transition is a lot smoother. So symptoms include hot flashes, night sweats, irregular periods, sleep disturbances, mood swings, weight gain, especially around the belly, fatigue, vaginal dryness, decreased libido, and memory issues. So that brain fog that all of a sudden I can't remember what am I doing here? Like, why did I walk into this room? Sometimes it's just because you're multitasking. You need to stop doing that. Women are really good at that. But if there's a new brain fog that's come on and you're just like, God, I just can't seem to like figure things out. That can be part of it too. Another one that I got actually like a run of it where I had a couple people in a row that came in. They were complaining of dizziness that had been evaluated by cardiology. So they'd done the stress test, the monitor, and all that kind of stuff, EKGs, everything. Um, and all of that was fine. Their heart was fine. They couldn't find anything going on. Maybe they had some, PVCs or something, benign. And we checked their hormone levels, and guess what? Their estrogen is low. And we improve that, and they feel so much better, and their dizziness goes away. It's crazy. These receptors are all over the body. It affects everything. It's not just your ovaries and your uterus and your breasts, obviously. So it can create a lot of challenges. We got to manage the hormonal fluctuations because they can get really out of control and make you just feel like you're totally crazy, like most of the month. I had that experience myself where all of a sudden things were just like, I had maybe a week where I felt normal. And then the rest of the month, I was just miserable. I'm like, what is going on? Well, I was 37 and under a lot of stress. And it turns out, yeah, my hormone levels were off and my thyroid actually was a little sluggish too. Again, everything all together. Coping with the physical and emotional changes, really important that we're talking about this. Maintaining a healthy weight. Oh, so as we get older, it becomes harder, but there's also things like increased insulin resistance. So it becomes even more important that we really clean up our diet. We cannot get away with eating all the crap we used to in our 20s. And most people know that intuitively, but it bears repeating because we still think that, we can skip meals, eat out, eat, a protein bar for lunch, and then have whatever for dinner, and then top it off with some wine. Of course you don't feel well. Of course you're not sleeping well. Of course you're gaining weight. Like that makes sense. So we need to turn these things around in order to feel better. Ensuring adequate sleep, adapting to changes in sexual health. So making adjustments, preventing bone density loss, strength training. What builds muscle builds bone. Also replacing estrogen, making sure that our estrogen levels are staying healthy will help our bone health. Reducing the risk of cardiovascular disease. No smoking. No smoking at all of any form. Taking care of if you have any underlying conditions like hypertension, really important to address that. Addressing that weight issue. If you have insulin resistance, that also needs to be addressed. If you have gut issues, that needs to be addressed. You can't continue to eat those inflammatory foods and expect good outcomes, right? And then finding effective treatments and support. And then the impact on the daily life. If anyone has ever been through menopause, perimenopause, or is currently going through it, you've noticed huge changes that can really impact how you're able to function. Your energy levels, frequently there's a lot of fatigue and reduced stamina. Work performance can go down. Sleep quality can go down. Emotional well-being, not great. Physical health issues there. Sexual health, oh my gosh, like not doing well there either. Social life, maybe you just don't even want to be around people anymore. Self-perception. I have a lot of women who have issues like they're like, I just don't feel good about my body anymore. And that should never be the case, right? We have the ability to turn that around. So health maintenance issues, focus on diet, exercise, preventive care, get your hormone levels tested, see what's going on there. And then daily routines, listen to your body. So I think that's one of the most important things is to make sure that you're tracking your cycle, you know what's going on there, because when we see changes in the cycle, then we can start to say, oh, okay, there might be something else going on here. Now, more and more, there's a lot of tracker apps out there that women are using, which is so great. So when people come into my clinic and I ask them, when was your last, or women, when they come into my clinic and they're menstruating, and I ask them, when was your last menstrual start date? They're able to tell me that because they can pull up their little app and look at it. That wasn't always the case, right? People really weren't keeping track of that. But it is as vital as your blood pressure, as your heart rate, as your respiratory rate, as your temperature. It is a vital sign, the menstrual cycle for the female. So it's so very important. If we're not ovulating and we're not menstruating on a regular basis, there is something going on. And it doesn't mean we just throw a birth control pill at it and walk away. Why is this happening? We need to investigate and figure it out. Now, I'm absolutely an advocate of using medications, birth control pills, or whatever we need to do to control symptoms while we are working on the underlying cause. But we got to work on that underlying cause, or else we pull away that birth control pill eventually, and the symptoms come raging back, usually with a vengeance, especially because it's when women are older and they're going through perimenopause, and all of those things that were just brewing under the surface, they just come back with a vengeance. So we need to make sure that we're addressing those underlying causes there. So to recap, if you are having changes in your menstrual cycle, and typically the first sign is a shorter menstrual cycle, and then it can kind of start fluctuating. Maybe it's a heavier menstruation, and that's also changing. You were used to be 5 days, and it was like kind of, first day was a little light, and then it was a little bit heavier, but then it tapered off. And then all of a sudden it's like 3 days, and one day is like horrific, and then it's over. Or if you're having really bad PMS symptoms, you're having bad PMDD, which is the premenstrual like depression syndrome, like really like you can be clinically depressed in that premenstrual window right there. And that can get worse with perimenopause. That is typically what's going on there is first hormone that drops is progesterone in perimenopause. And those changes can be very subtle, but we'll see things like anxiety and depression, trouble sleeping, shortened menstrual cycles, and things like that. And then we start to see estrogen dominance problems, not because the estrogen is actually high, it's actually not, but it's because the progesterone is low compared to the progesterone is low compared to the estrogen. And then we can start to see later on as things start to progress, then the estrogen starts dropping, and then we're having those symptoms. Usually the last thing to go is the testosterone. Testosterone tends to hang out for a little bit longer, but that will also start to decrease. And so if we've tried estrogen, we've tried progesterone, and we've got those levels better, but the woman's still having symptoms, things like zero libido, issues with, any vaginal issues down there, testosterone can be the next line of treatment, but it really depends on what's going on with the woman. So this is why individualized care is so very important with a provider who is familiar with this, who's comfortable prescribing hormone replacement, which is what we do at Antigravity Wellness. I think it's really important to incorporate this into a holistic form of care that it takes into account the gut health, the adrenal health, the thyroid health, a healthy diet that eliminates any type of inflammatory foods for the individual. And everyone has their own issues with certain foods, right? And then a fitness program that works for you, but will also continue to maintain, if not build, your muscle mass so that your metabolism is running faster, your joint pain is decreased, your bone health is stronger, and you live a longer, healthier, more functional life. That's the whole point. So thank you so much for joining me today. If you do have any questions, never hesitate to reach out. You can either send me a DM, you can put it into the comments of any of the posts or any of these recordings. I love to get your questions. I want to hear what's going on with you and if I can help. We are running, today is the last day for the Strong and Nourished membership, which is a monthly membership program that includes fitness, macronutrients, and a setup call with me, and then regular check-ins to keep you on track, and also gets you into the program where you go through modules and things like that to learn more about, fitness, nutrition, and everything related to menopause and perimenopause. Now, it's really, really important that we have this foundation. And this is a good program for either someone who's gone through the 12-week intensive with me, or even just someone who is pretty familiar with, their diet and exercise, but they just need accountability, which is a big thing, right? And maybe just a little bit more guidance specific to perimenopause and menopause. So if you are interested in that, I have the link on the ticker below, and then I will also make sure that is in either the description or the comments, today is the last day for that $97 a month to be locked in. The price will be going up to $157 as of tomorrow. And it might even go up from there, quite honestly, because there's so much in there that we are offering. So, and if you want to see more about my services, learn if it would be right for you, I practice as a nurse practitioner here in Washington State, which means I can, diagnose, treat, prescribe medications for people who are in Washington State. I no longer have a physical location, so you do have to be a resident of Washington State in order to see me. But I do also offer coaching services outside of Washington State. So we can do, like, the Strong and Nourish program is great for people who are not in Washington State or are in Washington State, but it's not a nurse practitioner program, it's a coaching program. So that's a great place for you to go if you still want help, but you don't live in Washington State. If you do live in Washington State and you're looking for someone who can help you with your hormones, take a look at your functional labs, go deeper on that. I would be happy to talk to you. You can let me know. I will also put a link to schedule a free discovery call. So you can give me a call, get that scheduled up, and we can talk and see how I can help you. All right. Thank you so much for joining me. Be sure to like, comment, share with your friends, anyone who you think might benefit from this. And I will see you the next time we go live next week. Thank you. Bye.